We are live.
Lives and Appropriations Tax Day. We are taking some testimony on some parts of the FY27 budget, H951. We have the agency of education here to talk about that section in particular. So welcome to the table. I'd like to introduce yourself and explain the issue you want to talk about.
Yes.
Did you have a hand? I haven't looked this. Excuse me.
We can confirm if Cassandra Ryan is on.
Yes. There she is. Yes.
Hi, for the record, my name is Katie Smith, and I am the Special Education Finance Director at the Agency of Education.
Welcome.
She's a connectable speaker. You'll be helping us run our slides. We also have Cassandra Ryan with us, and she is the Chief Financial Officer.
Hi, can you hear me?
Yes.
Okay, great. Yes, Cassandra Ryan, Agency of Education.
Welcome.
So we have some written testimony. We have a very simple ask. There's some important language that was in Title 16. We have a request for. And so I will quickly read our written testimony that's available to you. So just give you some background. The Agency of Education appreciates the opportunity to provide the committee with information on the intentional reinvestment of school-based Medicaid funds and their role in supporting prevention, early intervention, and safe and healthy schools. Historically, Vermont's statutory framework directs Medicaid reimbursement toward prevention and early intervention for students from pre-kindergarten through grade 12. These reinvestments allow schools to identify needs early, reduce barriers to learning, and support students with disabilities and complex health needs. Statute has long required funds to support both program administration and student-centered services tied to performance and continuous improvement. Ensures federal funds are used intentionally and with accountability, not absorbed into general spending. Student health and academic success are inseparable. Reinvestment supports mental health services, MTSS, nursing, family engagement, and wellness initiatives that address chronic absenteeism and disengagement. Evidence shows improved health leads to stronger academic performance, better attendance, and improved school climate. These investments are foundational, not supplemental to education. As a state education agency, AOE ensures that funds are used effectively and equitably. While the agency has collected reinvestment plans in the past, the administrative burden of managing school-based Medicaid program has precluded an intensive review of these claims. With the changes contemplated in the original version of H558, the AOE would have the resources available to review supervisor union plans, align investments with direct district quality standards and continuous improvement plans, and track outcomes statewide. This creates transparency, supports continuous improvement, and allows successful strategies to be shared. AOE's rulemaking rule is essential as Vermont moves toward federal compliance by July 1st, 2026, including the transition to a cost-based Medicaid model. In coordination with AHS and the Vermont Department of Health, AOE aligns education and health systems, establishes clear expectations, and adapts to federal requirements. This reduces administrative burden and ensures funds are used as intended, supporting students. Beyond compliance and oversight, the agency serves as a statewide leader and connector. It acts as a hub for data and accountability, tracking how funds are used and what outcomes they produce. It provides technical assistance and guidance to supervisory unions, helping them design and implement effective reinvestment strategies. It also positions Vermont as a national leader, as other states increasingly look to models like Vermont's to inform their own policies. Without a clear defined role for the agency, there would be no entity responsible for setting standards, tracking outcomes, or ensuring that funds are used in ways that benefit student health and outcomes. This work is particularly important in the current policy context. Federal guidance emphasizes the need for states to expand school-based Medicaid services and demonstrate intentional, data-driven use of funds, especially in meeting early periodic screening and diagnostic and treatment requirements. At the same time, other states are strengthening their policies to require intentional reinvestment, prohibit supplanting of existing funding, and ensure robust reporting and accountability. Vermont has been at the forefront of this work for decades. The question before us is whether to maintain and strengthen that leadership or risk undermining a system that has consistently supported student success. Almost done. Intentional reinvestment of Medicaid funds is at its core about outcomes for students. When these funds are used responsibly and strategically, students receive the health services that they need to access education, schools are better equipped to support the whole child, and communities benefit from improved long-term outcomes. The Agency of Education's role in reviewing investment plans, engaging in rulemaking, aligning systems, and ensuring accountability is essential to sustaining this work. Preserving that role ensures that Vermont continues to use the resources wisely and in service of healthier students, stronger schools, and better outcomes for all. So what is our request? A request for amendment to H558 as currently drafted. We respectfully ask that the committee restore and retain the full statutory language in 162959A as introduced in H558 to ensure Medicaid reinvestment funds are used for prevention and intervention programs. We further ask that AO's authority to adopt rules governing fund use, reporting, and coordination with state-placed student reimbursement tied to 162950 be explicitly preserved. Also, maintaining the July 1st, 2026 effective date is also critical to ensure continuity of funding authority and alignment with federal requirements. These actions will protect responsible stewardship, sustain safe and healthy school strategies, and ensure continued positive outcomes for Vermont students. You can, I can share my screen. I have some slides here too, and it's important because everyone can really help keep some of these details. So we'll go over this very quickly, but why are we here? This transition has stemmed from federal requirements that CMS gave to all states. They issued guidance in 2023 urging states to come into compliance with federal requirements for all school-based Medicaid programs. AHS and Agency of Education have partnered for at least 2 years to plan the system change and elevate the program. AHS definitely does have the heaviest lift for this. They are taking over the administration piece, but that leaves the door open for the Agency of Education to really focus on the quality components. This is just very quickly to highlight for you that other states see the value in structure and regulation. They all provide a structure on how to reinvest and report the data. And Vermont has had language in place for almost 30 years for this. These are other states that are currently working on legislation to add some regulations as well. And Vermont has really spent decades building a reinvestment framework that other states are just now starting to move towards that benefit students. And this point is important. I know it's a little bit wordy, but this is important because health and learning are inseparable, and this is about the student needs. There are health barriers that drive absenteeism and impact learning, and it's important to understand that chronic absenteeism is often driven by health needs and not by student choice. And when students' health needs are met, they show up, engage, and succeed. Sandra.
Yeah, thank you. I hope you can hear me all right. So this is well timed because the agency has been engaging in and continues to engage in many different conversations with the field and with stakeholders. And what we're hearing really can be boiled down to some consistent themes, right? Where we're hearing that they actually are asking us for clearer guidance. They're asking the agency to step into that role where we are helping them with adding structure to the mix. So rulemaking really provides the structure to clarify those expectations. And we look forward to hopefully being able to engage in that.
And Senator Norris.
Yeah, just got one quick question. When you refer to the rulemaking procedures, is that taking it from the Board of Education and putting it into the AOE? What are you referring to there?
Well, Sandra, can you help give clarity to that, please?
Yeah, I think that I heard it okay. I just want to make sure. So what I heard the question to be was around rulemaking and maybe the transition from where we are today to where we're asking to be. Is that correct?
Yes.
If not, could you please repeat it? Because it's a little bit jumbled.
My question, Cassandra, was when you're speaking about rulemaking, you're talking about moving that from the Board of Education to the Agency of Education?
No. Okay, so yes, thank you for the question. So no, actually what we were talking about is a new series of rules that the Agency of Education would hold. Currently, much of what we're talking about is actually statutory. So part of the change was to strike some of this from statute because it's not going to be as relevant moving forward the way it's currently written. And the proposal would say to right size this in future state would be to actually engage in rulemaking and all of the public comment and stakeholder engagement that is part of rulemaking to make sure that we right size as we move forward.
Thank you.
And this slide is just flagging for you that with the language that we forgot, we had some fiscal concerns here. We have a tie to the special education payments for state-placed students. And when a student is in a state-placed status, they are eligible for Medicaid. So this is just kind of connecting those two payment processes and then the effective date, which Cassandra can also speak to a little bit.
Yeah. Thank you, Katie. So yeah, I think the idea here is that the striking of the language is consequential to more than just the reinvestment of the funds. So while Katie is really talking to you more about those impacts, I wanted to also share two other areas that that we would hope we could talk more about. One would be the first is maintaining fiscal integrity of state funding for state-placed students. So as you may know, districts are reimbursed for costs that are associated with state-placed students through a dedicated pot of money, so separate. But when those same student costs are eligible for Medicaid, we have a need to prevent a double payment to the district and make the state whole. Currently, like current law on the books, does have a process for doing that. There will need to be changes made that are not fully contemplated yet, but the rulemaking process would be a fantastic place, and that's where we're hoping we would be able to do that so that we can make sure to do right by the state and the dollars. In addition, secondly, the change in implementation from July 1st to October 1st is problematic in that the agency did not include spending authority request in our budget for FY27. I believe that AHS has that in their budget, but we don't have the spending authority in our budget. So we wanted to make sure to mention that. So that change is problematic just from that fiscal budgetary standpoint.
And I think that another context to this is that the current model is claims-based, but we have a one-to-one. One student received a service, we get the money for that service. In the new model, it's going to be cost-based. So it's all going to blend. We won't be able to really tease out dollar for dollar for those state-based students. So we were hoping to then get a clear process through rulemaking. For context for this program, this is a $50 to $60 million Medicaid claims program total, which draws in $31.7 million in federal revenue. The other half of that is paid for by state and local dollars at the supervisory union level. And then just to note, there's about $15 million in unspent funds right now that's been reported to us. And this is, we've been asked for guidance on how best they can spend it. I think that they are holding on to those funds because they want to really get clear guidance on how best to use them. But we just wanted to note that this funding is waiting to be spent.
Do you have these, do you send these slides to us?
Yes, it did.
Are they not? I don't see them.
Really? That's weird. I'm sure.
Maybe I just have to keep first brushing different pages. I'll see it.
Maybe it did.
There were two emails that were submitted. The first had the written memo of testimony that Katie started us with, and then there was a second email that included the PowerPoint slides, if that's helpful.
Okay, thank you.
The data show, I'll fix it. Okay, thank you. So this slide, and this is the language as it is currently in statute. But again, I wanted to just flag more processes other than the reinvestment here. We have the link to the state-placed student payments and 2950. And then there's also The reinvestment is used by the districts in order to meet the requirements of the district quality standards in regards to the continuous improvement plan. Right now, we require that all of the reinvestment programs be tied to student performance in that continuous improvement plan. And that is section 165. So this slide really just recaps what we've spoken to in the written testimony and all along, but what happens if the language is removed? There's a lot of disruption. So if the statute connects funding, accountability, and student outcomes, removing it really breaks that connection. And we want to protect and improve the system that already works through the rulemaking process. There's the fiscal integrity piece that is impacted, that risk of the double payment. But then the other disruption is at the district level. So they have proven systems that are in place. They have local planning that's happening, committees and partnerships, and then we lose the data. So there's some outcome information that's lost if we strike the reporting as well. And this slide really, we're wrapping up, but this is just really emphasizing that we are partnering with the districts, we're partnering with Agency of Human Services and to meet the needs of all of our students. These are the things that we would like to include in the reinvestment process moving forward. That's based on the best practices of all the different states that have data on this. And just to close out, I want to tie it back to the students because these are services for them that wrap around the entire ecosystem of the classroom. We're invested in the data quality and we want to be student focused with this. And thank you. I don't know if you can have any more thoughts. That's it for me. Thank you so much.
Okay, thanks. So if I could try to reiterate what you're asking for. So we haven't talked about this, so we don't really know what this does. So in the House passed budget in section this 307.6, they make changes to the Medicaid school program, but you don't want any of the changes that they made. I felt all the strikeout and exchanges are just parts of it, because I also looked at page 558.
I think we are focused on stakeholder engagement. That we'll have to go back to leadership to see if they what their thoughts on that piece. But the parts that were struck completely was that rulemaking authority request, which would then replace those pieces that were in the code.
Yeah, I didn't see where it talked about rulemaking authority in this truck language, but I'm just kind of trying to glance at it while you're talking.
That is found in the language as introduced.
In its place. That's introduced in the other bill.
For H 558.
Okay.
It didn't make its way over it as struck language. So it just looks as if the entire section is just struck and then there's a stakeholder piece.
So we never looked at 588, and I looked in there and I didn't see a connection to this 16 VSA 2959 in that bill.
Yeah,
That's passed, but that's introduced. So I was looking at the past version. So maybe as introduced, there was some.
yeah, something got lost in connection. I'm not exactly sure what happened, but there are two different versions in there. So the original language as it was introduced, if that is the right phrasing, that is what we worked very hard on to come up with when we first proposed this.
So you're basically saying you like the way it was as introduced, that bill and what the House did in the budget. Most of it you don't like, or at least the part that was struck, the part you don't like.
Yes, so we did strike some of that in there. We did, but we replaced it with the parts that said what the district shall do. We struck it to replace it with the rulemaking language that we put in there.
Okay. And this, you haven't talked to Senate Education about this?
No.
Did you talk to House Education? Or did it just go through?
We were at House Healthcare, and then it went to House Ways and Means, so we were not called to testify before these changes were made. So we're here with you now.
Okay. All right, well, we have to do more work, or maybe we would ask SWAT our committees to look at this specifically. Because it's all new to us, other than we just saw that there have been these changes, but I think even this part we gets over. Wait for more information, so.
I understand.
So if we look at 588, that's what it was.
Five.
Five. We should look at the as introduced.
Yes, please.
I just put it under her name on her committee page as well. For folks.
Okay.
Just the page 558 as introduced.
So I was looking at the wrong bill. So this bill got introduced, but didn't pass. Got it. Well, I guess it doesn't look like it's been passed. It's referred to as cost appropriations. Still in the house.
I believe they moved the language to the budget.
Yeah, that's probably what they did. They probably said, okay, we'll just fix it in the budget. Let's see. Okay, well, thanks for the information. We will.
Thanks, appreciate it.
Yeah.
And if you need anything, please reach out. We're happy to come back and talk more about this. It's just.
Any other questions for AOE on this? Okay. All right, well, thanks for your time.
Thank you very much.
Thank you.
Thank you.
Excellent.
Victor, where have you been following this throughout the process? Or are you here for some other reason?
Julie Richard, Joyce's office. Yeah, I would say that the JFO team has been working on different sections of 558 and then the language that's recorded. So,
So if we have questions, that it could probably help.
yes, absolutely. Me, Nolan, and or Emily. We have one to help you with this.
Okay, good. We don't have any experience with it.
I love it.
Yeah, thank you. We have center lines. I guess remotely if people are wondering, so if you're feeling better. Center lines, you don't have to speak, so strain your voice.
Thank you. I can't speak very well at all. I did send you the memo from the committee,
Okay.
and I also have,
Oh, I have a copy.
yeah, and I also have the budget recommendations. When you want to go through that, it might be, I can do it either today or tomorrow. Nolan is here. So, whatever you think is okay, there you go.
Okay, we'll maybe talk to Nolan, maybe you'll feel better tomorrow, or your voice will be better tomorrow.
I was hoping you'd say that. Okay,
Yeah, you have to do that.
okay.
Alright.
I'm here, I'm listening. And
Okay,
I also have 5 or 6 language recommendations, some related to this proposal and some just changes to be made based on conversations with the administration and others.
okay, and does Nolan have those, or Grady or something?
I'm not sure. Katie said that Grady might have some of them. I'm hoping, and I'll make sure that we get all of those to Grady. I have hard copies with me, but that doesn't do you any good.
I have all of her number recommendations, number of
Language recognition, okay. We'll figure that out,
Yeah, so when we get to them, I'll speak up.
yeah.
Okay.
If you want to, while we're meeting, make sure Grady has the general idea, that would be good.
Okay.
So we're gonna have Emily come up and have us go through another spreadsheet. And just as a preamble to that, so we looked at what we have. So we had some duplicates on the list and things like that from our discussion yesterday. We got the amount of money that we're over, lower amount, but we're still over by $10 million.
Only 10 million.
Yeah.
I mean, that's down from
35? Yeah, yeah.
That's great. That's significant progress. in like 20
Although
hours.
that's not what, yeah, that's not what the list, I guess that's like,
Oh, okay.
if we had just,
Oh.
yeah.
Still good progress.
Don't get excited. Yeah, don't get that excited. I guess get excited that we got it on one, because some of those things were just in my head. I hadn't decided about. But it's just a position of the Senate that we get the House budget, we get the governor's letter saying what he doesn't like about it. We have our bill that presented without kind of knowledge about the budget. And then we have some fiscal pressures, like if pro tem makes us stay longer, we're gonna have to fund those. And other new information that's come forward. And in my 3 years on the committee, we always had more money than the House did. This is the first year that I've been on the committee that we haven't had more, we have less. Downgrade. Well, the downgrade affected them too, but just like we didn't have any new information of like property or money, and all the money that we have like in reserves is going to buy down education property tax. So in the past years when we've had money from the prior fiscal year, that's been money that we could use for one time. Well, we're like saying, okay, all that's going to buy down property tax. So without any new money, it's hard to find ways to fund any Senate priority without taking it from the House. So just to see where we are, I asked them like we could go through, we went through the language that the House presented. We're going to go through the line items and see if there's anything that we're either like, this is important, we all can agree that we're not supportive of it, or just flag for more information, and I think to see what on the House bill we can talk about. Does that make sense?
So we're gonna go through the House ads
Yeah,
right now?
right now, well, any moment now.
Sorry. So for the record, Emily Byrne, Illinois Fiscal Office. I also have, this is the sheet you went through yesterday with some updates to get the double counts out, all that stuff. So I'll hand this out first. So I'm not gonna walk through it first. We'll walk through the House stuff. The things that are on this sheet, I've added to the House sheet. So there's green lines that are, these are all the things that you all wanted to add. And that's what will, at the end, in theory, all include this plus some choices that you make on the House side of things to see if you're so 20 million ahead or under or sideways.
We call it 20 million behind, 20 million ahead. I guess behind. 28 million in the hole.
In the whole, that doesn't sound like a head.
No. Our head's not even sticking out out of the hole.
If you put some photos or take a picture and try to
So maybe take a quick look at this and ask Emily any questions before she hands out the next spreadsheet. Can leave that for the Emily. You're ready to go.
Should be actually. No.
So should look familiar with the copy that and it's on a bigger sheet of paper.
Your sheet of paper, that's important to you all. And we tried to organize it a little bit more, so it's got what's, there weren't very many base changes, couple House, couple one, couple in the base, mostly one time.
same deal, 100,000.
Oh, yeah.
The transportation committee is asking for 400,000, not 5.
Great.
That's the right direction.
Which bill is this? What number is that?
It's up on the top.
Non-emergency medical transport.
Oh, I see. Thank you.
Then Emily broke out the Senate bill so you can see specifically how the totals are there. Some of these things, which I think we talked about yesterday, have funding today. Like base appropriations. And so we might try, it's kind of hard to get it all on one sheet, but might be able to provide some of that information in the future. For example,
Oh, that's on the next sheet.
well, even just like the VHIP, so on the next, that's where we see it on the.
Yes, on that sheet.
VHIP. S 320 is 5 million, but there's, the governor had 4 million in the base. But I guess that's not a good example of it. I guess it's more like the server and environment has 500,000 in base money. And I think there's 300,000 here or something like that. So even if an entity or a program has, you don't always see on the sheet whether they're already getting, so they might have a base appropriation of 500,000. This is asking for more. So if you cut for more, it still has a base appropriation.
So are all of these that are in bills, is the 50,000 state treasurer, the study consultants, public employees, is that general fund money?
Yes.
Or does that have to be general fund money?
Doesn't have to. I think all of this is general fund. I don't know if
It's
there's,
all general fund, yeah.
I don't think there's any special funds.
It's,
Doesn't have to.
That's something we could look into.
but wouldn't that, if we're looking at, employee, health benefits authority study, does that have to be general funded?
I'm not sure. I'll have to ask Chris about that. But we can look into it.
That's when I was out where we study of combining state and other unionized.
When we have the Public Employee Health Benefit Authority Board, I don't think it matters.
Yeah.
Funding source.
It was, it's like for per diems and an expert or something.
It's to study creative authority, right? Like who's hiring contractors, actuaries or something like that.
Now, if you want to take more money out of the transportation fund, that's.
I just saved you 100,000.
That's good. And then on the back side, other bills.
These are the other bills that when we re-looked at them yesterday, didn't, the other bills in this one of the dispatch thing that didn't really have a general fund impact. So the S89, I guess that one does have a general fund impact. That one I should probably carry on the front, but the voc rehab, VDOL said they can absorb it. The tobacco position, there's been discussion about funding it out of tobacco litigation settlement fund.
Right.
Which I did just flag that we haven't talked about the tobacco fund. We can bring in a little snapshot of it, but it would. We had this conversation, deja vu from last year, but the tobacco settlement fund is projected to have a deficit, I believe, in FY 2028. This would just accelerate, or FY 28 or 29. We'll just get it there faster, but
Right.
that's just a view. And then the DMV stuff that was on here is T fund impact. Then yesterday there was a conversation about the dispatch funding. There was unallocated, there was an appropriation made, I want to say back in 2024 for $11 million related to dispatch, sort of waiting for the legislature to allocate funds. So if we allocated 2.35 million of that 11 million, that's not fully utilized yet, it would be the sort of, it's the last chunk of that money to be allocated, but you would need this year money you'd be using money that was appropriated in 2024 for that purpose. So you don't need to carry it on your 2027 budget pressures.
And GovOps is looking at that bill this week. Having dispatch folks in. I think they took some testimony yesterday, and then they're having folks from the task force and others in Friday. Okay. Any questions about this sheet? What's not on here is also any house bills. We had a bill, we had a sheet at one point, looks like this sheet, that listed some house bills with money in. So there's a House bill that came in after the budget that the House did put into their budget that we care about. If you want to flag that. The JWs. Okay. So. Thank you, Emily, for
You're welcome.
updating on the sheet.
I'll have this one out.
When are we planning on getting this done?
We were hoping to take a straw vote on Friday.
There.
You know, if,
I've got a few things, my sections that, like, there's some money left over in some these. Oh, sorry, I thought to move it
Yeah.
around. When should we weigh in with all of that? I'm feeling a little pinched.
yes, likewise. Um, you should let Grady and other JFO staff know if you have any language like that. I'm pretty sure they're aware of that language, but we should make sure. It's
I have some language that will go.
the VHC. You're talking about the VHC.
They got a VHCP language that they've got money left over that they want some authority to.
Doing all
I've got,
disability.
I think it's probably the language. I've got some language that, goes with, like, 100,000 I asked for Dale, for the, keep the fund going to, the adult days,
Right.
and then.
Well, we have that money in there. Yeah, so let Grady know, and then we'll hopefully be able to go through that language. We might focus on the dollar amounts first, and then work on that on Friday. So the goal was to have it straw voted on Friday so that staff could work on it over that weekend and get us to on Tuesday. So you could vote up, because we're getting out of here on May 15th. So. Something got. Yeah, okay. Okay, so Emily just passed out a new sheet. Emma, what do you want to tell?
Sure, so this should look familiar. This is sort of the construct of the base budget. What I've done is added the Senate column, but the Senate column is all empty. So you'll need to fill it in and sort of affirm or reject what you want to fund. And then once we have a better sense,
When you give the bottom line number here, that we're over,
yeah,
does that include the house stuff all in?
no, that bottom line number, I should have taken that number because it's irrelevant right now. Because you have, well, you've got,
So we're over, like, if we didn't do anything on that the house building costs.
we didn't do anything that the House or the governor proposed as major changes to the base. $150 left is what that 100 million means.
Nice.
But
So you're talking about the bottom line.
on
I'm
that,
talking about to get in balance.
The bottom line here is just the total of these numbers.
Yeah.
So this doesn't have to deal with the budget. But yeah, and here you could just take it. Take the 92, so we will do the subtraction us, we have to do it. Sure. So you're saying 90, well, row 94, we should ignore.
I would ignore row 94. First.
And this doesn't show, or I guess this. It doesn't, it shows a difference from the house. It says the house is budget. That would be the amount we're out of budget. So. If you look at lines 38, 39, that's the number that we're short.
Which number you say?
Minus 3, so it's 75 million. Right,
Which numbers you get 78?
lots of lines 78, rows.
Oh. Line 78 are just the changes. Oh, it's not a good one. I should have hidden these.
So the way this reads, if we've got 16 million, they've got 92.
So I would think of it as governor has $85 million worth of changes. The House had $92 million worth of changes. So far, you've only decided, and you haven't really decided
Right,
on
but
it.
this is not,
So far, I've only filled in $16 million
Right, I
worth
get
of
it.
changes. So once that column gets filled in, that number will, the line 78 will get bigger. Line 94 will get
so you can look
smaller.
at it, we have $75 million spent. Good say, but we haven't done anything.
We haven't spent anything.
Right, we haven't spent it.
Yeah.
On the baseline.
Correct.
So yeah, so this is a little different than when we're always looking at the bottom line, just because at this point we have the prices. Got them.
Correct. Want me to jump in?
Yeah, no changes at the top, thanks.
No change to the top, right? If there were suggestions or proposals to sort of to change things that are your normal growth in government or modify programs, that line 1 potentially could change. Additionally, so on line 2 is the Pay Act appropriation for testimony on yesterday. The pension increases and then the base transfers, which the majority of that base transfer is the debt service transfer and the cash fund transfer. There's a change to the cash fund for debt service and the tax computer organization fund. I shouldn't forget that.
Because we're putting that up front, so we're transfer money over there for that.
Yeah. You can think about it, it's like paying your existing bills.
Okay,
So then the lines, I can walk through each one of these. So lines 5, 6, and 7 work together. These are the changes that are going on with the Agency of Digital Services. Based on sort of how they're changing, how they're billing, how they're changing, how funds are appropriated to them. The net impact is a $15 million increase in general funds. It's a function of both changing how costs are allocated to departments, which has that net of line 6 and 7 impact of $5 million for the general fund. And then there's a $9.08 million increase of general funds to the agency of digital services.
yeah. And was this part of the design to lower this deficit in that technology fund at?
Yeah, more to
Yeah,
stop the bleeding from that fund.
what's that called?
The communications and information technology, CIT.
So the CIT fund has a large deficit. We brought down some of it. But we made these changes, or ADS made these changes to avoid that from getting bigger.
And if you'll recall, finance and management has sort of rearranged how ADS's appropriations works to try to get a better handle on where the money's going,
Right.
what's going on with spending.
So 5, 6, 7. Does anybody have any questions with these? I guess what I want to know is if you want to, if you're just like, okay with it, you want to flag it for consideration for a change. Give
I would say right now, it's probably, this is mostly, most government stuff that they're doing.
Yeah.
We put it in and if we had to, we're gonna get to the bottom, if it's too high, somebody's gonna have to go back and tell us. That's probably, you're gonna be the center of that, but
yeah, so I'm just getting your input. If there's anything that would come across here, like this is something that I think we've cut, or we need, I want more information before we keep it in. So I'm gonna say 5, 6, 7, we're okay with at this point. But that things could change. That's just gonna. Okay.
Sure, so line 8, for the tax department, there was a position added by the House based on anticipated changes in the ed transformation bill. My understanding is when the ed transformation bill hasn't passed the House yet, they still anticipate that if the changes that are in the House bill go forward, a new position will be needed at the tax department to help with the accelerated implementation of the homestead declaration. And you're moving the date of when the homestead declaration is due, and the tax department indicated that if that happens, they would likely need additional resources to complete that work on time.
Okay.
If that doesn't happen, the tax department doesn't need a position, but
Anybody have much problem with this?
Well, it's a House position. It's not ours yet.
And I don't see any way around, leaving money in the budget. But the education bill will probably be done after, right? So
So would we leave it in here, or would we do?
Just
We
put it
pick
in
a
here.
number at the bottom line and say, we're gonna leave at this much money someplace, because we might do something different.
yeah,
You know what I mean?
Should leave it on the bottom line, so if they pass the bill, or we just say make sure the language is in that bill as they need for this position.
Well, by the time we get to a conference committee, there will be, and we don't wanna not have money for the transformation, but what if we do something different?
well, it's a good question, Mr. Chair. So if I'm trying to remember, I think last year the governor, we sent the budget before the ed bill, governor signed it.
Yeah.
And then any shortfall would be made up in budget adjustment.
Yeah, and we had one bill that was still active, H-90, if you remember, that the governor did veto, so we had that $10 million that was probably going to be spent in that. We dealt with rest here. So yeah, we'd have to, assume when this gets to conference, there'll be more of those kind of discussions between this bill and the transformation bill.
I suppose I would rather put it in and figure it as though it's going to happen, and then as opposed to the reverse of taking it out.
We could take it out and leave the money in.
I'd just say that seems weird to me, because, if we put it in, if everything we put in the budget funds their transformation stuff, but we decide to do something different, the negotiation becomes, well, we'll take everything that you put in. It reflects everything we want to do.
So are you suggesting that we take their stuff from the transformation bill, have it on the bottom line?
I would rather do that, because then we have a pot of money where we haven't dedicated everything that follows exactly the way they've done, because if we do something different, I'd rather have an unencumbered pot for us to choose from.
I'm pro.
Okay.
Well,
Yeah.
wondering if we do that, suppose we go through that process and then in the end, still end up needing money, which seems unlikely, but if that were to be the case, then is that a reason to have like a contingency list? I mean, maybe we're gonna do that anyway.
That might be good, but what I don't wanna do is fund all of their stuff and they walk into the conference and you say, we'll take that. And then we're down, how do we negotiate out the money? That's just,
Yes. Okay.
last year what happened was there was 4 million on the bottom line, the budget went, and then it was appropriated in Act 73. But that was the sort of construct, right? So we'll let the bill
Yeah.
settle it.
but that doesn't dedicate, it just puts the money on the bottom line and then.
Yeah, so this position should go to the bottom line.
Yeah, the money for the position.
Yeah.
Nice. Okay. Treasurer's office.
Line 9, this one is for H567. These changes, but this is the bill that moves the OPEB investment consulting expenses to VPIC. It's a net neutral sort of, we actually saves general fund and then the expense of the investment consulting costs goes to the pension funds themselves. So in the web report, you see this down in the treasurer's office, and then there's a couple ups in the teacher retirement and all the VPIC appropriations.
So we would support this because it's basically $11,000.
It would be contingent on 567.
110,000. Yeah, 567 has the language. And also with the treasurer's office, that even though there's money from pensions that pay for the new position at VPIC, treasurer's office was going to ask for a new position if they have to continue to manage the OPEB investments. Okay, so that's okay. Mediator's edition, alert.
So the House added and a new position at the Labor Relations Board to do mediation work. So, all right, my understanding was the loss of the elimination of the federal program
Yeah.
for mediators.
I had some other more information that I needed. I got good information from the LRB, it was helpful. But there's something else I need to ask. So. Let's flag this is still open.
I,
You want to say something, Sarah?
you know, what's just hard is, if we start refilling federal money that's gone away, where does it end? And that's going to be hard. And that's nothing about what labor relations need in position or not.
Okay,
It is gonna, I think, be one of the sticking points in the negotiation with the House, voting, Ways and Means voting to pay down property taxes only so far to save a pot of money for these eventualities. So I support the following the governor on the buy down, but it does raise the question of where we can come up with money in the event that it goes away.
yes. To the Ethics Commission,
Ethics Commission, this is an additional position to help support ethics work that municipalities need to do. I believe there's also language associated with this.
yeah, no. And I think we got a letter to the committee, or the letter was an email where there was concern from the Ethics Commission that while they appreciate the position of which they've asked for several, they didn't appreciate the line 11. They did appreciate the additional work. Because the House gives them a position, they don't just give them a position and then they say you have to come up with a new handbook and it's like a problem now. So the Ethics Commission kind of felt like you gave us a position, but you gave us the work equal to a position. So we're still behind on all the work that we're doing. And so when municipalities submit ethics complaints to us, we still won't, all we can do is say, look at the handbook and not actually do the kind of work that they were hoping to do. So I'm leaving, I would like to leave this open. You need to talk with Ethics Commission, and then I heard also that there might be some other language on this in House bill, maybe, so I need to look at that.
Go to line 12.
Thanks, yeah.
Line 12, this was proposed by the governor, accepted by the House. It was also in the Budget Adjustment Act. This shifts the reappraisal and listing payment appropriation from the general fund to the pilot special fund.
Right, and so this is also talk a little bit about interpretation. We were okay with it on the Budget Adjustment Act. Are we okay with it still? Okay, we're okay with that.
That tracks it with me talk.
Line 13 at the Attorney General's office, this makes the home improvement specialist position permanent and funds it in the base.
I think this is an important one. Is anybody not like it? Okay,
Line 14, the Defender General's office, this is an additional $350,000 for training and for contract costs and case related.
There's just him hold for the.
you wanted 80 for training?
No. What it does is, he had it broken in two different areas. The top and the bottom was $580,000, yeah. Then it's the bottom part, the total was 1.6 or something, because he wasn't close. What this house proposal does, it takes $50,000, $350,000, of which is from the pretrial, and moves money around because they're compounding their money, not using the program. So the $350,000 was moved from there to his fund, and out of that, $50,000 is going to be used for training. Yeah, the $300,000 would be used for those two top positions that let's see what they're not positions, but contractor services and whatever else. He knows about it. 350, you know.
Okay,
Is he happy? Probably not.
correct.
Well, it's 50 for his training.
And it's getting him some.
It's getting him some.
Right, and it's getting it in the base where we were giving him one time before and he wanted it.
Yeah.
And then I'll tell him I got this training.
Yeah. Okay, people are okay with that? Okay,
So you're good with that one?
yeah,
Okay. The next line is in green. This is one you talked about yesterday. This is the additional security cost at the judiciary. This would be an additional 480,000 over what the House added in. Would bring the rate for the judiciary fees, or would approximate an increasing the rates that they negotiate to about $60 per hour.
So this is bringing in more. So
no, this is costing more.
it's cost.
We would raise the per hour contract for these security guards that's a course.
So that's not parentheses over.
So the House put in 250. This has you putting in 730 or 726,000, which is an increase over the House of 480,000. So it's only in parentheses on there because there's nothing filled in on the House.
Oh,
It's not a parentheses in
the delta.
the delta's worse, so shouldn't it? So
I would.
I'm willing to be wrong.
It's not a parentheses.
I would ignore the difference from the House column because everything is a zero. Everything is less compared to what the House was, right?
But for right now, but that one you had added it in.
That one I did add
So the 0.48 is
in. Is
480,000 more. If it was a negative, it'd be 480,000. But
Right, so it should be.
no,
Oh, see.
it's more.
Oh, okay.
Yeah,
It's
you're
the
proposing more
parentheses
than that.
were, and it, but like
I
we
see.
said, since the Senate column is zero, there are a lot of them are
Oh,
negative.
let's see. Okay.
But whatever number you put in there, then they would calculate it. So like you'll notice on the House, the difference from the governor. Or in the House thing, it's only where you're saving money, like taking money from the pilot instead of the general fund, that saved 3.41 because that money was coming from the general fund. So this is all focused on the general fund this year. Okay,
So the next three rows are buying back the vacancy savings of the state's attorneys, the victims advocates, and the sheriff's
Does
budget.
this take the vacancy savings to zero?
Correct.
and that's what I was gonna say, like, we were supporting getting their vacancy savings down. If we need to find a little money, it's hard to believe it would be zero. Like there's some
I can't.
instances gonna happen somewhere, but they didn't want to have to manage to a number. Because they have the state's attorneys in all the different counties. They don't have real control over all those state's attorney staff. So it's harder for the central office to manage vacancy savings in that kind of way. But we could lower it to some other number higher than
That's
zero.
what I was thinking. you know, even if we just cut it in half, because no one is zero. And, you know, the standard practice across state government is, you know, 3 to 5%. And so I just find it hard to believe that you're going to have no vacancies.
So we'll look at that a little closer. The military positions are a little bit of money, most of it's federal funding.
Yes.
So 150,000 general fund brings in 442,000 in federal fund for these positions. These are new positions, these are making permanent.
New positions, I believe, right?
People, okay with that? Yep. Okay,
And the next one in the military, this was proposed by the governor. This is moving the costs of the FTE who works on the Veterans Cemetery to a special fund, or off the special fund to the general fund. But the special fund can be used for at the cemetery, and then the position funded in the base budget.
was that because the special fund didn't have enough money? And so we're gonna do that. We might support the USS Vermont submarine port crew. I'm assuming so. CCDS,
Yeah, line 22, this is another $100,000 for crime victim services for grant administration.
Sorry, CCD.
Center for Crime Victim
Oh,
Services.
what was it, is that a position?
Not a position, it's just more funding to help grant.
It's right there for
I can't remember off the top. Amy, do you
crime victim
remember?
services has had a hole. I think what's funded them hasn't it been a declining there because
Yes. Does it get funded from,
I think it was 50/50. I've looked at it, the grant positions, grant administration support service.
the fund, did they get funded from court fees and fines and that's been declined?
Suppose like, ticket fees, search areas and marriage licenses, but
Right,
they have.
people aren't getting arrested and they're not getting married.
No, no.
I wonder if we had a divorce fee, maybe
we probably need more money. So.
Okay, we'll look into that once more. Get back to you on what exactly that was for. Can't remember off the top of my head. Okay, we'll go to line 23.
Very good.
This is moving funding for the supervised visitation program to DCF Family Services. My understanding that this happened already. This would just make it a permanent budget shift rather than having the money go to crime victims and then crime victims transferring it to DCF. This just put it in DCF's budget. So it's a net neutral change to the budget.
it's not neutral, but you, okay, the house had a negative 140.
Yeah, and then in DC, when we get to DCF, you'll see a positive.
Okay. New position of ag,
New position in agriculture.
What was the new position?
services manager, administrative services, and we'd have to look it up in the deeds. I don't remember. But then that they asked for it.
Yeah, agriculture asked for it. It was to help them with their business office, because they have a really small business office.
But didn't they have the funds from within their budget? I think that's it came below this list. Governor's question 3, I'm like 2.8. When they did the presentation, they said they
Maybe.
weren't asking for general funds because they found the ways within their equity office, within their budget.
I have to look at it, but I don't know. I don't.
Okay, so we'll look into that a little more. Also on ag is the elimination of the fees for the large medium farm operations, if you limit fees, they have 230,000 for the positions.
And the governor and the House report is on. Just saying,
Well, we know from yesterday, there was some debate on that, so we'll leave it open. Yeah. The Secretary of State's office, this is the only base one. This is the van, media access TV. This is an increase to the base. Correct. You know what the base is?
Oh, I did.
It's, with this, it's 1.8.
1.8, yes, with
Yes.
1.8.
So it's 1.3 now.
1.35, I think.
So just bring the book.
Does anybody have any problem with this one? HRC, Human Rights Commission. They were one of our earlier budget testimonies, if you remember, but this is the vacancy savings buying, because they were kind of mandated vacancy savings that they were confident that they were going to get. I don't think we bought it down to zero. You remember?
I think the House may have bought it down to 0 and then added up to the general.
They have a few positions. This looks like
very
they said
small
they do
amount.
have 0 because they have what?
Yeah.
2 people or 3 people. So that's one of those 3 people. They do have 0%. Any comments on this?
I just thought we were gonna address positions as a whole.
Right. We'll do that as well.
Well, I would like to see them get their vacancy savings. Because I think their vacancy savings, when they came in here, was really high.
64,000.
64.
With how many employees? It's a very small.
Nine.
So 64K of this 170 is West Fourth vacancy set.
That's a fine number for one people.
No, 64 is, oh no, that's that. Yeah, I did.
In 26, it was 25,000. And
And then the administration increased it to 64. Okay.
I just.
Yeah, I agree.
So. That's got a lot more sympathy for the vacancy savings.
139.
Yeah.
So,
that we would close it?
no, we'll leave it open because we talked about looking at all the positions as a whole, but that might affect somebody.
Yeah, and the vacancy savings is different than the new positions. But, and particularly when we're saying up above that the state's attorney gets 0 vacancy savings. And you've got 9 positions and 64,000. And their last year was 25,000.
Yeah. 3.5%.
That's a little strange.
Line 28, the cannabis control board.
Yeah, and this one's really a technical one related to Cannabis Control Board used to utilize the special fund and then transfer what was ever left of the special fund to the general fund. That was only a sort of 2-year time frame. Now they're in the general fund with everybody else. The cannabis money goes. Appropriation is in the general fund now.
Right.
And all of that money goes to the general.
Normally
fund.
this would have been taken out and then they would have returned the rest of it. But this is just, we're just gonna
It's been flipped.
appropriate.
Correct.
Unless somebody wants to take money out of the cannabis control board's budget, we would agree. Not.
Now, they're doing a great job. Using the money, I think,
Right. That's
And then line 29, this one's also a technical one, so this is sort of added in all of the Agency of Human Services. This is the general fund needed for all of the changes to the global commitment funds related to Medicaid caseload and other changes there.
good. Look forward to do that.
In line 30, you'll recall in the Budget Adjustment Act, there was Well, in the FY 26 budget, the AAA's case management was not included in the original rate increase language. So it was added in the budget adjustment for 1 quarter. This annualizes that expense for all of fiscal 2027. What's the BAA changes?
It would have been in the governor's budget probably.
If it had been in the base in what you passed in 26, it would have been in.
So just to go back and like under the Center for Grant Victim Services, $100,000.
Yep.
Which for additional funding for grants administration.
Right.
But not a new position.
Not in this.
On line 31. This is the same as the line above. This is related to the tier 1 enhanced residential care rates. Again, in the FY 28, I'm sorry, 26 budget, there was a change in the residential care rates. It resulted in there was an adoption of a rate study. It resulted in a reduction of the tier 1 residential care rates in the Budget Adjustment Act. That rate was brought back up to what it was prior to the passage of the FY 26 budget. And this is the annualization of that rate change into FY 27.
And what is the tier 1 enhanced residential? What is that?
Oh, it's very nice.
What are we talking about?
Should know this.
We'll go back to you.
Yeah.
But is it like nursing home, like that kind of
It's,
care?
I want to say it's a home health. Specialized home health. I'll be it. It's not. No, it's not home.
The residential care homes.
There's like ERC 1, 2, and 3.
This is not the nursing home. These are.
We'll get back to it. I don't remember.
Well, the residential care homes are lower acuity.
Lower. Tier 1 is like below. You go up from there. Yeah.
We'll get back to you.
I think that the Craftsbury place, this is not skilled nursing.
Lines 32 and 33. This is the general fund match for a rate increase for DA's, SSA's, home improvement and skilled home health rates. This provides agency of human services additional capacity to negotiate increased rates with those entities.
There's a good match with the global commitment.
I see that in the DA's, that would be the mental health is, I see the elder care program is provided, but they'd be in the first line, right?
I'll have to get back.
Like the county mental health program.
Yeah,
I assume they were either DA or an SSA.
yeah, that's what I was,
And the elder care program, I understand it was a reduction in the governor's budget.
This is buying back.
This is buying it back.
Buying back the rate.
The elder care program.
There's a reduction in the program that I don't know what's the House bought it back. This is separate rates.
Do you know what the increased rates are for the DA, SSA?
I mean, the percentage.
It's roughly 1%.
but in line 32.
In
Yes.
line 32.
For the mental health agencies, it's half what they asked for.
Yeah.
They were all asking for 3.5%.
It's about half of that.
Okay. A little over 1 million. Okay.
We go to line 35. Or AHAC, primary care loan repayment. The House had primary care loan repayment, but they didn't have quite as much money in for it. So per the conversations yesterday, this would fully fund the general fund component of the loan repayment program, right?
I think Center Alliance. This was not.
Yeah, that's part of my work for the primary care that we'll be talking about with our spreadsheet. And I've questioned, Emily, this used to be B311, was it changed to 301?
It's supposed, that was an error on JFO's part. It should be in B311.
Okay,
The health department, if you accept the funding this, we'll put it in the right part of the budget. It was in the technical letter from the administration.
okay, thank you.
Yep.
Okay. Placements.
Yeah, this is the House funded the MD placement program as part of AHEC. Total global commitment of 50,000.
What's this for? What did you say? Do not concur with the proposed funding.
Oh, I believe the governor.
On their buying that. Thank you.
The governor reduced all the AHEC funding, so this was putting back the different components of the AHEC funding,
Okay.
or some, but not all.
So line 37, in DIVA, this is a technical change, assuming you adopt the policy shift that's in the big bill that the Agency of Education was speaking to. This is more of the technical side of it. But so the governor proposed, or so the proposal to move the school-based Medicaid program administration from the Agency of Education to the Agency of Human Services. As part of that, there was a special fund that AOE utilized for administrative costs at the Agency of Education. In talking with the department, with AOE and AHS about this, we figured out that it probably made sense to take AOE out of that special fund since they're no longer going to be administering the program, and have DIVA utilize the special fund. So there's a net neutral shift. It's in DIVA, the Agency of Education, partly in the Department for Children and Families, also had some of this Medicaid special fund. So all the special fund spending authority goes to DIVA, and then we take general fund from DIVA and move it to the Agency of Education and the Department for Children and Families, just to clean up who's utilizing the fund. All of that goes pretty technical update.
We're good with that. Yeah, April change. Bridges to healthcare, remind me.
Bridges to Help, I believe, is a program to support.
Farm workers.
Yeah.
Oh, right.
And we'll also be talking about this one when we go through the recommendations from our committee. Flag that, yep.
And also it's in DIVA, but it should be in BDH.
I think that's.
Oh, right, thank you, Nolan.
And I believe I misspoke earlier, Senator Lyons. The general fund appropriation related to APEC happens in B301. And then in B311 is where the global commitment appropriation for APEC happens.
Oh, got it, thank you.
Yeah, and the Bridges to Health is incorrectly in DIVA. It should be in the health department.
VDH, got it.
If you want to do the Bridges to Health program.
Got it.
Okay, harm reduction service is an extension of what we did in VA. I assume people are up there with that. Is this the free and referral clinics have a base appropriation? This is an increase to the base?
I don't know if they have a base.
I thought they did, that this was an increase.
We will find that.
Okay.
What is the
They came in, there's clinics that are free for, it used to be called clinic and insurance. You can't get service if you have insurance, these clinics. They're health clinics, right?
For anybody?
And
We had a doctor from the big,
yeah, because I think that doctor volunteers here and there, but right, I think there's 7 of them or something. Yeah, maybe there's more. They're scattered about the state. There's a federal program that got started, and this is support. Often it's cheaper to have them seen, because otherwise they have to go to the emergency. some of that's helping them with their medication.
It's 50-50 match.
Don't look into what the current base. DCF housing. This is something that Central Lines will be dealing with. There's several in this.
Yeah, it's part 930. There's several of these pieces that are part 930.
So we'll pass on that.
Yeah,
This is what we already talked about, but the general fund share.
yes, there are a few components of the rate for DAs and SSAs that it's only paid for with general funds. So this reflects that component.
Okay. This is the additional money is for 211. And it's just buying back a decrease the governor did.
Correct.
So it's not a change to their base appropriation, just keeps it, but it's lower than, it's higher than what the government wants. Correct.
So this is going to be part of our discussion for our memo as well.
Okay. We'll hopefully you're able to, we'll go through all of the health and welfare stuff tomorrow.
Yeah.
Okay,
Terrific.
44.
44, and then 47 and 48, these are all related to the housing changes. Should be looked at sort of as a whole package related to
That's 938.
938.
We'll look at 40, line 46.
Yeah, and just,
45.
line 45 and line 45 and line 46, these are all technical related to, first one is that change for Center of Privacy Services, moving the supervised visitation from them to DCF, that neutral impact, and then DCF impact is changing the school-based Medicaid funding, giving them general fund instead of special fund. Out of that fund. So if you go down to line 49, is the opioid recovery and employment program.
47, 48, same things that we just.
Oh, yeah, yeah.
Right.
And I should flag line 49 and line 53 are net neutral. So that was in the wrong. Governor proposed to put it in the Dale admin budget and it should have been in Dale.
So this is also going to be in our discussion for our memo as well.
Okay. So I'm expecting a lot of this month. Okay,
I've seen the list, they were there.
okay, good. So line 50,
Line 50 is a disability housing coordinator, that was added by the House. New position at Dale.
that's just in general, how things, everything else serves, to find out.
Believe so. Hopefully, we should keep that on for the new position.
That's position, so that would probably that
Yeah,
position discussion.
Then line 51 in Dale, home and community-based rates. This is the general fund, the services that are on the general fund. So do those other rates above, get a little bit of general fund. At Dale. Line 52, these are funding for individuals who are both deaf and blind. Understand the funding for their services was cut.
yeah, this one,
I don't think we could have.
I think we-
Or not to.
yeah, I was gonna say, this one we need to do.
They already clicked with 54.
Yeah, line 54, we talked about, that's a neutral change. Line 54 is the statewide pretrial services program. The Governor added, I was concurred with.
People. Okay with that?
What are they doing again with that exactly?
Well, that's a good question. Anything know?
Was it just to extend the trial?
Well, so they had monies from two counties, they weren't working, we shifted it to Burlington, and we're adding more money. We took something from the base on this.
So is there like a reversion of somebody? Okay,
So do you-
They can put it back into the general fund, $850,000.
I mean, what's that?
While she's looking that up, we'll go to 55.
Yeah, line 55, this is the pretrial supervision program going away. So you can save 850,000 part of the corrections,
Almost,
almost going away.
not quite.
850 is going. Increase to the healthcare advocate.
Yep.
So the Green Mountain Care Board pays that for legal aid that pays for the health care.
The legal aid or,
First, the healthcare advocate, not in legal aid.
It is.
It is.
It's an
Green Mountain.
HS contract. But they use a combination of bill back and global commitment. So you're seeing it in the Green Mountain Care Board. Because that's where the general fund would go.
Okay. So it's 60,000 general fund, but
And it gets you 450 gross.
with the
and then there's two positions, the Green Mountain Care Board for Act 68. Everybody know what is
did
here?
we not give the positions from Act 68? That was, we gave some and then we're giving them the rest of them this year.
I think it was, we gave them some last year and roll out for this year, if I recall,
Just to be fair, Act 68 is,
transformation.
So,
Is this two positions?
Yeah.
Yeah,
so in that line 56 is the layout kind of number, why did development?
No, 56 is the healthcare advocates. They came in and asked for an increase,
Okay,
saying they had that increase in years.
okay.
And so they're-
57, I got put.
Yeah.
The positions of the board.
then we'll talk about that with our position sheet. That's on your position sheet.
Yeah.
Line 58, this is the final transaction related to the school-based Medicaid program, it's neutral.
And then
Line 59, this is additional funding for the positions that were created in Act 73 related to education transformation. This makes them permanent positions and fully funds them. Annualizes their costs.
this is just annualized cost for last.
They were in Act 73, but not the full amount.
Okay,
I think
we're done.
I heard them.
We have to do that one.
Lines 60, 61, and 62. This is the 3% increase that the governor included to the higher education institutions.
And this is just for the general funding, I mean, other than VSAC, which is scholarships, the UVM and VSCs to their base spending for salaries and everything, right?
Correct. Line 63, this one's a little complicated and related to the miscellaneous tax bill, but in the House version of the governor's budget proposed, including funding or fee revenue from a new access fee for folks who utilize fishing access areas, but don't have a fishing license. So it would be like a boat type charge. It was a new type of fee that they proposed through their rulemaking authority in the miscellaneous tax bill. That authority is being removed. And they're requesting that the department come to the General Assembly with a recommendation on what the new fee would look like, how it would work. Because the House miscellaneous tax bill removed the authority to create that fee, it leaves a hole in the Fish and Wildlife budget, so it has to bring the general fund back to the level of budget.
And that fee, they didn't say what it was per year. They rolled out this rate.
So we took some testimony in Natural Resources this morning on this particular issue, and it sounded like they were planning on it sort of ramping up over time. Mostly starting with warnings for people to give them a heads up, like, hey, this is a new thing. And it would just be for access for the fishing.
That's like what federal boat act. So
Yeah, it's like the fishing access points.
Right.
And particularly for people who are there basically just to paddle. Because if you already have fishing
Yeah.
license, then you're covered. And we talked about the structure, and I could go on.
It's if they're using the boats, they just walk through the woods and put their paddleboard and go, then they went out.
Right, if you got to the same body of water from a different access point, you wouldn't have to pay.
It's if you're using the
Right,
structure, but it doesn't cost us.
right. And if you're on the water, no one's gonna be like, where did you put it? It's not, that's not the point. But, and the discussion, the committee came to basically the same conclusion as
House.
that house.
So,
This.
I'm more concerned with the authority, removing the authority to implement through rules. Now is that in your committee, discussed in the committee at all?
We did discuss that. I mean, we didn't go too deep into that. We mostly were like, would we want to allow this to move forward? And I think the sentiment of the group, there were strong feelings in opposite directions. And it felt what it sounded like was where the house ended was like come back to us with this report, like check in again next year. So whether or not we remove the authority, I suppose if we really didn't want them to do it now, makes sense to remove the authority, but we'd have to give it back to them. Should we let them move forward in the future?
Right.
So, just to follow up. So I'm clear, is the authority now removed? Or is it?
Well, and as the law stands now, they do have the authority to do this. They did check with our legislative council.
Okay.
And so the city's tax bill removes that authority that currently exists.
Miscellaneous tax bill.
Yes, there's well, as passed by the House, it had one appropriation in it, so I believe it would.
Was it this?
No.
This was, I thought there was appropriate, because the $50,000, this is not in that. Oh,
That lived in the budget, that traveled with Fish and Wildlife Space budget. Miscellaneous tax appropriation is related to the 10-year tax study.
So that I got this straight, we're not eliminating fees and putting money into the general fund. Or back don't have a general fund money.
Yes.
That's what the house construct is.
Okay.
So if we
didn't do that.
If we did
Just say it.
I mean, it's a fair point.
if we disagreed with the house contract, we would say $50,000, because we say they're gonna get this from their fee that they're.
That we just took away their authority to do.
Well, we did, but the house
Well, they did, somebody did.
If
they
we,
tried.
we have to,
So it doesn't happen. They're in $1,000 hole. They can build themselves. Well, yeah.
You get where I'm going.
oh, I
right?
do.
Okay.
Oh, I do.
Robert, I'll leave that home just for.
Yeah.
Discuss that.
So then,
You want to treat everybody the same.
Wow, there you have it.
Right. Okay. Flood safety.
Flood safety, this is 2 additional positions of the Department of Environmental Conservation related to Act 121, the Flood Safety Act. If memory serves me correctly, they wanted 15 positions, the legislature gave them 11, this would give them to 13.
This is the one where the deputy secretary is in here the other day saying that wording on classification was wrong.
Correct.
This comes wrong from their point of view.
Yeah.
They wanted, but we'll talk about positions.
Line 65, this is $4 million for VHIP being added to the base budget. And
And it's been around 4 or 5 million in the last few years since it was created. If I remember correctly, it's always been.
right, it has been one time, so might be right. Thank you. Line 66, federal matching funds for the Arts Council. just to ensure that they fully draw down the federal grant they have. And then line 67, this is the technical line, this is all the other all of the other ups and downs, budgets that are more technical changes.
All agencies picked up.
Yeah, all the other all other. The general, they don't really rise to the left.
Single. Okay,
Okay,
reserves.
so in the reserves, these plugged in what these are. I need to revisit these. So these two calculations are statutory calculations. The reserve for the stabilization reserve is based on prior year appropriations.
Including the VA.
Including the budget adjustment. So it assumes the budget adjustment. Maybe you'll remember those confusing thing that I talked about at the very beginning yesterday. So they have changed to FY 2026 appropriations minimally, but it will drop the amount that needs to go into the reserve. So we should be able, if you accept the changes to the 2026 budget that are really technical changes, then you save a few pennies on the reserve tech. I will flag that as an Emily follow-up for you. That may be a thing that we finish on over the weekend, because
Right.
once it's all final.
And if we make changes to the C section, then they have to recalculate it.
Correct.
Right.
Correct. And then line 71, that's the 2750 reserve. That's this statutory calculation. That's one.
So 410, we just passed yesterday, right?
I want to save a little money here, like, that's part of it. That's
Okay.
$25,000. I know they wrap up, right?
That's right. Yeah.
25,000.
25. Have you heard about these 559? I just drove over. Do you guys know what it is with the judiciary?
I have a vague memory.
Each bill, so I don't know if
I don't remember discussing that.
you have discussed it yet.
Sorry, the brief.
Advanced evictions right now. Well, we'll hold that open just because
Hold all these.
all these, activating.
And I don't know what 657, that change is, in that bill, there included a change in but it eliminates the reach up asset test, and that will probably cover the expense.
The expenses to do the study, or once you do it,
The cost of eliminating the asset test, it's estimated cost, the additional cost.
okay,
So
then we'll ignore these totals.
you ignore the totals. We go down to the revenue part.
Yeah,
The top part, this is the forecast from the emergency board, plus the additional amount that's redirected to the property transfer tax based on the outstanding language that's always in the budget, and then the direct applications that are Department of Financial Regulation, the AHS earned federal receipts, the Attorney General's office, unclaimed property, sports wagering, liquor control. Those all come to the general fund. There was a small change in the amount that the House is taking from the AHS earned federal receipts, which is why it's slightly higher in the House to the governor, but there aren't additional changes.
okay,
And then finally, at the very bottom are the changes in the miscellaneous tax bill. So those are still outstanding in terms of what your colleague across the hall will do. But
the big one is the linking and decoupling to 15 million more.
correct. And that's netted against the change in the rooms tax. So we'll have to figure out, there's some changes in the transportation bill associated with the purchase and use tax and transferring money from the general fund to the transportation fund as a whole. The finance committee has the miscellaneous tax bill that has the House's proposal on how to manage the movement of money between the transportation fund, the education fund, and the general fund. The governor had a different construct. We'll have to true it all up in the end, depending on whatever he decides.
Out of transportation, 400,000, that's like this. You get to keep the money. So we save you a little money.
Very generous.
We try to be nice.
Okay, so yeah, there's gonna be an interesting interplay between the miscellaneous tax and TISA in the budget. Granted, all three bills.
All three.
TISA has a lot of interesting things.
All encouraged by the chair for that great. It's a good bill.
I could tell it did because Richie wants it. Oh,
Yeah.
Well, we did what the chair of appropriations told us.
it's a double region.
Okay, thank you. And anybody have any questions for them?
So what I'll do is based on this conversation, I will fill in that column. I'll put some highlights on ones that you had questions on. And then tomorrow we can look at where that
And,
was the bottom line.
And you would have the same sheet for the one times?
Yes, we can do that now.
You do have,
We can take a quick break and then do it.
that's what I was gonna suggest. That was gonna be my suggestion. If you had it ready, that was taken. Sick for but just so folks, well, these are all based.
A lot of those changes,
Or one-
I would think are one time, and that's another thing we'll have to, especially with the bills themselves, to navigate which. I put a lot of them in the one-time bucket, but that was just
But once we look at it,
my judgment.
the two total, we'll kind of guess where
You'll need it.
Okay, so we'll take a quick break and then come back and do the one times.
Could you be a little more definitive?
Quick break, as quick as possible. No, I guess like